sperm DNA fragmentation is being related to to any changes in the structure of the sperm, and usually that involves single or double strand breaks in the sperm. There are different tests that they examine the levels of fragmentation on the sperm DNA, and those tests they need to be done carefully, obviously in the lab, to give us accurate results. And depending also on what sperm DNA fragmentation test has been done, those tests, they might give us, apart from the average score of the DNA fragmentation, as the DNA fragmentation index, as we may call it, they can show us the level of the breaks we have on that DNA of the sperm, and also the proportion, the average score. So it can show us the extent and also the proportion of the sperm that they have those fragmented DNA. So how can we use this information of how much, what is the proportion of the sperm with a fragmented DNA and with high levels of fragmentation, or sperm with low levels of fragmentation? So we can, the clinicians can use that information to determine whether a patient would be benefited, for example, from the presence of any antioxidants, and patients may take antioxidants for 3 months, for example, and then after those 3 months, we'll have to do another DNA fragmentation test to see if the integrity of the sperm DNA has improved, or whether they need to do, for example, a testicular ultrasound to see if there's a varicocele going on, which might also affect the quality of the DNA, as the varicocele can increase, since increases the blood flow within the testes. Also, it can increase the temperature, and that can increase the oxidative stress in the testicular environment, and hence it can have an effect on the DNA integrity. Also, apart from the steps that can be followed prior to embarking on any ART techniques, if the couple has to use the assisted reproductive technologies by having a high sperm DNA fragmentation index, the fertility experts can decide what type of ART treatment can be followed. So, for example, IVF versus ICSI or IMSI or PIMSI.